Good morning, everyone, and welcome to the Partners Community Cafe. I am Amani Pegues, and I'm the health educator with the Community Engagement Department. And today, our topic will be Alcohol Awareness Month. And we will delve into alcohol use, some of the social implications, prevention, treatment, and recovery. So, we have a slate of speakers today. You all will hear from Delton Russell with Partners, Jeff Eads and Gary Marshall with Partners, and Kyle Button with Partners with Phoenix Counseling, excuse me. I will ask you all to introduce yourselves in the chat. Please put with organization you are with and your role. We like our community cafes to be a networking opportunity. So these topics that we discuss, the conversation continues and the work happens within the community. Also, after each presenter, if you have anything to add or any questions, you can unmute and ask your questions, or you can put them in the chat and we will read them off. So we will go ahead and get started. Our first presenter is Delton Russell.
Hey folks, can everybody hear me okay? Take that as a yes.
We can hear you pretty good.
Good. Okay, so I want to just kind of go through some stuff that some data that I've recently pulled. This is all partners claims data, and I think it lays out a really interesting case. Now, I want to be clear, this data specifically is people that have Medicaid. So, if we're pulling people that don't have Medicaid, the data is going to look a little bit differently, but I think this makes a point. So first and foremost, I'd like to say that we spend a lot of time talking about the detriments of opiates. We spend very little time talking about the detriments of alcohol. And that's because alcohol is legal, it's very socially acceptable. A lot of people use alcohol recreationally, so on and so forth. But it can still definitely have some pretty serious impacts. So let's get started into that. Well, if I can get my slides to, there we go. Sorry, it's just a little bit slow. Okay, so when we compare alcohol use and opiate use diagnosis in the past 12 months, again, this is partners data. Alcohol costs, people that have utilized services is $31,619,188. Opioids is $26,745,099. Alcohol inpatient admissions, 1,008. Opioid inpatient admissions, 752. Alcohol emergency visits, 2,867. Opioid emergency visits, 1,836. Alcohol mortality, 57. Opioid mortality, 31. And then I thought this was interesting too. Alcohol use by gender, 65% male, 35% female. And then opioid use by gender is 35% male, 65% female. Now, again, this, to be clear, this is just Medicaid data. So Medicaid, the people that are going to have Medicaid are sometimes going to be skew the data and make things look a little differently. Racial demographic, the African-American community, 297 versus Caucasian, 468 for alcohol use. Then we were looking at opioid use. We've got 127 versus 658, which that tracks along, what we would expect. When we talk about comorbidity, again, the comorbidity with alcohol, we see a 64.5% prevalence with nicotine dependence. But when we look at opioid, we're actually not seeing but 61%, right? Well, those are about expected. But then we start looking into pain. Okay, so 30% with alcohol, but the pain related to opioids would be 59.8%. And again, those kind of things track. But then we start seeing a lot of other things that maybe don't transfer over, like type 2 diabetes. We would expect that. Anxiety, related to anxiety related to alcohol use, 49.2. But then we're not seeing that in relationship to opiates, but at 56.9%. So, those kind of things track as far as, what people are using, why they're using, so on and so forth. Yeah. So looking at next slide here. um, Prevention is really the important piece here, right? So like the reason I was showing the comparison between opiate and alcohol is I wanted to highlight that, again, alcohol is very socially acceptable. Opiates are not very socially acceptable, but they both can be incredibly detrimental to the people that are using them. So we want to talk about prevention. Whether we're talking about alcohol or whether we're talking about opiate addiction, prevention is really the key, right? So the brain's not done developing until around the age of 25. That is the reason that we have extended the not only tobacco to 21, but also alcohol to 21, because we're trying to give the brain a little bit more opportunity to develop before we start introducing substances that release excessively high levels of dopamine into the brain. So 9 out of 10 adults with a substance problem started using before the age of 18. Youth who begin with using active substances, whether it's tobacco, nicotine, alcohol, illegal over-the-counter prescription drugs, whatever, before the age of 15 are nearly 7 times more likely to develop a substance problem compared to those who delay first use to after the age of 21. So that is my brief slideshow. The purpose in wanting to share this information again is to highlight that addiction is addiction is addiction. We often make a huge distinction between alcohol use and opiate use. We would often see people give their teenagers alcohol, but we wouldn't see people give their teenagers opiates, right? But the reality is whether we're talking about opiates or whether we're talking about alcohol, it's still early onset use impacts the brain. It creates the potential for arrested development. And as a byproduct of that, puts the person in a position where they can experience active addiction well into adulthood. So it's important that we understand, alcohol isn't as harmless as we often view it as being. There's a lot of very serious complications that come along with that. And of course, if you've ever met somebody that's in recovery from alcoholism, and they'll tell you that, the alcoholism can bring you to any low that, any illicit drug can possibly bring you to. Thank you.
Thank you, Delton, for opening our discussion about alcohol use. We're now going to transition to Jeff Eads and Gary Marshall.
Good morning, folks, and I'm going to attempt to share my screen here. Dynamite. All right, and again, good morning, folks. My name is Jeff Eads, and I'm one of the regional directors of community operations at Partners, and primarily work in Surrey, Yadkin, and Iredell counties. However, I do work with some of our system of care efforts across the 15 counties. So I work very closely with Jerry in Surrey, Yadkin, and Iredell. But Mr. Marshall and I today have been asked to do a little bit of a follow-up, and this is an abbreviated version of something that we did for something called In the Know, which was part of the Drug Alcohol Coalition of Iredell's mini conference recently. So some of you were there. You're going to hear some bits and pieces of that again. But what we were doing today is really going to build on what Delton said in his presentation about alcohol and some of the social acceptance around that. And ours is going to be, I'm going to approach it first, and then Gary's going to follow up as a person who has worked in alcohol treatment as a clinician and as a professional. And I'm approaching it from the angle of somebody who is in recovery from alcoholism. So I think at the Docky presentation, folks heard me say, "Hey, I'm Jeff. I'm an alcoholic." That's one thing that folks hear a lot in the world, especially around 12-step programs and things like that. But most of the time when I introduce myself, I like to say, "Hey, I'm Jeff. I'm a person who has is on a personal discovery about his own recovery journey." And, so sometimes, usually what I say is, if I am something and I say I am something, I'm likely to become that something. So I use my words carefully, and I like to tell people I'm hopeful. I am encouraged by things, and I am grateful to be a part of this conversation today. Now we have people on this call who have longer term recovery than myself, and I'm grateful for them having paved the way with this. And of course, alcohol is deeply personal to me and my family, as I have again a personal history with alcoholism, and um, and I'm sure other folks do on here as well, either as a family member or personally. So in the next few minutes, Gary and I are going to share with you some of our perspectives, and keep in mind these are somewhat personal. And as we as we look at these things, this is more of again, this is awareness, and this is us giving you some of our story and sharing our information to start conversations, continue conversations, and to share our contact information with you so that we can be a part of this. And one of the things that, again, Delton brought up some of the pieces about how is it going with partners and what are we seeing here. But one of the things about alcohol use in North Carolina is it is the third leading preventable cause of death in North Carolina. And Delton made a point of bringing some compare and contrast with opioids. It's like, man, we hear all this opioid settlements, opioid crisis. Why do we not hear as much about alcohol? And I'm going to touch on that just in a second before I turn it over to Gary. But we had 6,300 deaths in 2021. And one of the things that the media and a lot of times what we see out there is it looks like a lot of the folks who are dying, you would maybe think that the folks dying of alcoholism are the kind of the chronic person with alcoholism that's been going on for years and years. However, that's not really the case. 90% of excessive drinking is done by people who are not alcohol dependent. And what I mean by that is they don't have the physical dependence on it medically. Okay. And because there's a difference. I mean, there is alcohol use, there's alcohol abuse, and then there is alcohol addiction, where people have developed a physical dependency on alcohol, as I did. However, excessive drinking, and what I mean by that is that could be binge drinking by folks. I mean, that could be folks who drink more than they can handle at a time and then make decisions such as driving or things such as that. But excessive drinking is associated with violence, chronic conditions such as stroke, hypertension, and even some cancers as well. But I do want to point out some of the excessive alcohol use in North Carolina. And again, it's a noteworthy finding that, again, folks, 90% of excessive drinking is done by folks who would not be labeled as alcoholic. And so this is an important distinction in terms of, because again, use of alcohol, use of any drug is very, very, very personal. It's very individual. And there's a diverse spectrum of alcohol related disorders. And I really like that word spectrum, because anybody can suffer from an alcohol problem if it's causing them issues. It's just that, again, these terms alcoholic, substance user, substance use disorder, addiction, there's all nuances. And one of those things tend to build on each other. So one of the things that, before I get to Gary, that I did want to point out is, what are some of those big differences in the way that we talk about alcohol, and how can it become that silent killer? And back to Delton's point, opioids require prescriptions. Now, that doesn't mean that people can't buy those without prescriptions on the street or something like this, but alcohol is a legal substance for adults in most countries. And there are some regulations governing its sale, distribution. But however, how it's advertised and how people perceive alcohol is uh, is very different based on where you live, your culture. Again, so it's a very much a spectrum. But opioids, especially illegal ones, are often stigmatized, and those again get associated with crimes and et cetera, et cetera. And we see again lawsuits, but alcohol has a long history of social acceptance, and in many societies, it's very culturally significant. I mean, that's what we see at things like social settings, celebrations, lots of different rituals, things like that. But one of the other things too is we approach it very different. And a lot of folks that are on this call today have heard words such as harm reduction, which is where folks are continuing to, they may continue to use a substance, but are doing it in a safe way, et cetera. With alcohol, harm reduction isn't typically looked at, and many recovery programs are an abstinence-only model. But in alcohol harm reduction, we're talking about things like public education, responsible drinking, and restrictions on advertising of alcohol and availability of that to folks. But also that we have different policies that govern in this. And because of some of the alcoholic beverage industries influence, cultural norms surrounding it differ based on opinions on the appropriate level of regulation. And what Delton said earlier too, which is a lot of this stuff is based on opinion, and some of those opinions can be mythologies. And so before I hand it off to Gary, what I want folks to know is recovery from alcohol use, abuse, addiction is not easy. It is very varied, and there is no cookie cutter approach to this. Everybody is different. And I hesitate to use words like programs, et cetera, because again, it's one of those things where there's not a program for everybody. There's not a treatment modality for everybody because alcohol can lead to other things, as any drug can lead to other things. And alcohol, we've heard in the past, alcohol and drug problem. Alcohol is a drug and should be treated as such. But I just want to say that for those of you out there who may know or be personally struggling with this, it can be a tough one because again, alcohol it's on every corner, it's in the grocery store, and it's definitely hard to walk away from at times. But there's help available. And certainly I'm going to put my information in the chat. And if folks want to reach out about this more, I would love to talk with you. So I'll stop there and I will turn it over to Mr. Marshall.
Thanks, Jeff. Just as Jeff started his with being a recovering alcoholic, I always start mine with the fact that I have not been an alcoholic nor an addict of any kind in regard to substances and things of that nature. My walk when it came to working with people in addiction and recovery started many, many years ago as a young pastor for many years, having many families, some of the best people that I knew in the church, some of the best men, most supportive men that I had in the church who were alcoholics. And they would not say that. They did not know that, nor did I. I could smell it on their breath. I could hear people talk about them out in the community. Typically what I would smell on a Sunday morning smelled a whole lot like mouthwash and chewing gum as a means of trying to cover those things up. And it was hard for me to understand how they could put alcohol or any substance ahead of their wives and their children and things of that nature. As time went along over many years of working with families, men and women both who developed cirrhosis of the liver, automobile crashes, families separating and breaking apart as a result of substance use, it would break my heart, but I didn't know how to help these folks or had no idea. You know, the old Forrest Gump movie thing, stupid is as stupid does. I mean, that's kind of what it looks like to a lot of people when it comes to addiction. And it's easy to be very judgmental around that kind of thinking. But the longer I was involved with families, the more I realized that these were not immoral people. These were not weak-minded people. These were intellectual people. These were hardworking people. These were people who loved their families. These were people who cared about many things in life. But something about these substances, alcohol in particular, back at that time, had just absolutely taken over everything about their ability to make rational choices and decisions. As time went along and my heart was more and more broken, you do enough funerals around addiction losses, around the loss of life and things like that. It causes you to have to do a lot of soul searching as to there must be a way to help. So I began that journey of the educational process, trying to understand, finally became an LCAS, licensed clinical addiction specialist, and worked with children through Children's Hope Alliance as intensive in-home QP. And then later, of course, when I had my LCAS, I started working with Daymark, doing their SAIOP programs and other men's and women's substance recovery groups. And one of the things that I learned is exactly as both Jeff and Delton have said, addiction is addiction. But people would come into the groups and they were there for alcohol, and they would look at our group as they were doing their check-ins and they would say, well, I'm not here for drugs. I'm use alcohol. I don't use hard drugs. I'm here for alcohol. And it was hard for them to understand that addiction is addiction and that drugs are drugs. And all those stages and phases that Jeff talked about are very true. But when you finally are at a point where life has put you in a place that you have to be in a recovery program, that's a different level right there. Your life is at risk. And one of the things as a recovery counselor that I used to try to help folks understand, three things we would always teach is that addiction as a disease of the brain is a chronic disease, it's a progressive disease, and it is a terminal disease. It will eventually take someone's life if they do not find a way to get into treatment and recovery. I'd have ladies and men come in and crying in my desk doing the assessment saying, if I don't get this right today, if I don't do this program, I will lose my children. If I don't get this right, I will go back to jail. If I don't get this right, I have got to do your program. This is my last step. I will die. And I've always been able to say to them, what I want you to understand is that the power of addiction is greater than the power of love for your children. The power of addiction is greater than the power of your need for a job. The power of addiction is greater than your concern for your own life. You will let all of those things go if you don't take this addiction and recovery opportunity very, very seriously. And just in a couple of seconds here, a couple minutes, just to kind of put it in perspective, one of the things that we used to try to help them understand is that addiction rewires the brain. If you can imagine spending the rest of this week walking around on your hands and let your hands serve as your feet and your feet try to serve as your hands, and imagine how clumsy that's going to be and how ridiculous you're going to look and how terrible some of the things are going to happen around you. That's what addiction does to the brain. It rewires the brain. As addiction kicks in and as the substance use kicks in, the top part of the brain where our intellect, our rational choices, our moral decisions, where all of that regulation takes place, the substance, alcohol, puts it to sleep. It cuts it off, said, hey, we don't need this up here anymore. So once you cut off that rational thinking part of the brain, then the emotional part of the brain kicks in. Well, how do you want to be living this world in an emotional state, making all of your decisions out of an emotional state of mind? But that's what's happening as it progresses and goes along, and it literally rewires the brain. The primary thinking of the brain when it comes to addiction comes out of that survival part of the brain, which means that everything is tied to emotion and everything is tied to knee-jerk emotion. And when it comes to addiction in its full-blown sense of the word, rational choices, emotional regulation, memories, love of anything, love for anybody, all of those things go away. Moral regulation, all of that goes away, and everything happens in a knee-jerk response of, well, I feel sad, I need to go drink. Hey, I'm happy, I need to go celebrate. Oh my, I feel stressed, I need to go celebrate. Every emotion is tied to the need for the substance. And once people begin to understand why their choices look so bad, why it's so hard for people to understand why they are making the decisions they are, it's not because they don't love them, care for them, all of those things. It's because their brain has been rewired to work out of an emotion mindset that requires help from the addiction, help from the substance. Recovery allows someone to begin to heal, get them into sobriety long enough so that the brain can begin to come alive again, so that those top parts start working again, so that those top parts start having control again, and so it stops being such an emotion-driven life of decision, which is tough because guess what? That's when memory comes back alive, and that's when people begin to realize some of the horrible things that have happened while they were in addiction, and then that in itself becomes a trigger to want to go back. So it's a horrible beast once it becomes that disease of the brain called addiction. And everything that Delton has said, everything that Jeffrey has said, everything that we can do as recovery counselors, as partners providing help for folks, is just give them an opportunity to understand the truth and to get to a place where they can get in some level of sobriety, some level of abstinence long enough to get there, who they are, back in control in their heart, in their mind, and get the real them back in control, and that disease called addiction out of control. So thank you very much.
Thank you both, Jeffrey and Gary, for those unique perspectives and powerful perspectives. I would like to open it up for anyone. If you want to unmute, if you have comments or questions, we'll take a pause.
Hi, I got a question. So we have the chronic alcoholism, right? So people are over the top that really need help. But in the areas of prevention, right? You brought up responsible drinking, right? So, I'm around a lot of people that drink for various reasons, right? For homelessness, for depression, anxiety, and so on. What programs or data points are out there to educate and counsel folks on responsible drinking? Because they may not drink because they're able to function in normal life, but their first reaction, to your point, to anxiety, to sadness, to celebration, and so on and so forth, is to grab that drink. So we don't hear much about responsible drinking except on a TV ad at the bottom of the screen of a beer commercial, right? So I'd like to hear your perspective on that.
I'll take a stab at that one first, and then Delton, Gary, Kyle, others jump in, please. Because responsible is different to everybody, isn't it? What is a celebration? Rob, you're right, is different to everybody. And this goes beyond stay hydrated when you're drinking or something like that, or eat food. You're talking about something different. You said people that may be experiencing homelessness or having anxiety. And one of the ways I've looked at that personally is even in times when I thought I was responsibly drinking, right? And that meaning I wasn't maybe causing harm to someone else. There was the part where there was not a tool available to me that I could find that would help me deal with that anxiety. There wasn't a tool other than that would help me with the depression. And like for you mentioned, Rob, there are people that their social or personal situation is such that they're seeking some type of reprieve from that, and there's not a tool in their box to be able to do that, right? Without using some type of substance to give them that relief that they are seeking. And that's a really difficult thing to do because people by nature, when they're hurting, seek relief, right? And people seek that relief in a variety of different ways because we all hurt. We all experience joy, and how we interact with ourselves when we're doing that is so incredibly different. So, Rob, to your point, I don't think that there's probably a canned program that says this is what you do when you're doing it responsibly, because it's going to be different for every single person. But the one thing that I usually ask people, and again, it's just because of my own personal journey with this, is when someone says, you know what, man, I could really use a drink right now. You know, the hard question to ask is, okay, well, you could use a drink right now. What is it you need right now that you can't find that need to be met in a different way right now? And a lot of times folks will say, man, I don't know. I don't know what it is that I need. And that's the most powerful need of all, is not knowing what you need. You know, it's like asking a person, what are you feeling right now? And they say, I don't feel anything. Not feeling anything is probably the most powerful feeling you can have. Not being able to name what you need is huge, because I will tell you from personal experience, I was not very good at naming what I need, right? I'm a trained counselor and all that kind of stuff. And I can ask other people, but asking yourself, what is it right now in this moment I need that's making this look so attractive, right? And that's a difficult thing. So, Rob, you bring up a good point, which is what is responsible? I would say that, uh, everyone has to define that for themselves. And because I don't know, I could not make a list of things that said responsible drinking looks like these things. But I'll stop there and turn it over to the other folks in the presentation. So thanks for letting me share that.
Hey, yeah, I'll take that for a second. So, Rob, I too, much like Jeff, am a person in long-term recovery myself. And much to Jeff's point, responsible drinking looks very different to each person. I can't personally drink responsibly, but I also can't really eat donuts responsibly either. You know what I mean? I mean, it sounds like I'm kidding, but those things come from the same place, right? So like things that release elevated levels of dopamine into my brain are things that I really have to be careful about, because that elevate I naturally because I've experienced a significant level of trauma. I've sometimes struggled with having naturally lower levels of dopamine being released in my brain, unless I'm physically like manually working to take care of that. So I have this chemical imbalance, and because I have that chemical imbalance, I often look to other things to make me feel normal, right? And in doing that, I have to be very intentional about what I look to, right? So like things that are helpful for me are things, like eating healthy or getting exercise or communicating, learning how to be vulnerable, all those things. But if you look at programs like refuge recovery, right? Refuge recovery talks about responsible drinking. Like if you've been in the program and you get to a certain point, there's talk about kind of maybe trying to see if you can drink responsibly again, at some point. That's not something that I identify with, that I would feel works for me, but there are some people out there that can work for. But to specifically answer your question, I think that what refuge recovery talks about is that in order to do something responsibly, you have to be very self-aware and have to be very cued in as to why you're doing the things that you're doing. Much like Jeff was talking about, like being being in touch and in tune with why you're looking for those higher levels of dopamine. What is it that you plan on getting out of drinking? And that's hard to do because drinking in and of itself blunts your ability to have that level of self-awareness. So, it can become a pretty complicated thing. Like a lot of people that use opiates think that alcohol is not their problem. So they use alcohol, but then when they use alcohol, it lowers their inhibitions and they find themselves using opiates again while they're intoxicated. They didn't mean to go that route, but that's just kind of how that happens sometimes. So I think drinking responsibly is drinking after the age that our brain's done developing, and B, being tuned in and asking yourself, why am I doing what it is that I'm doing? What purpose am I trying to get from this? But that's kind of a hard ask for a lot of folks.
Thank you, Dalton and Jeff. We are going to transition to our final speaker, Kyle Button with the Phoenix Counseling Center, and he will provide a additional layer to the conversation that we're having.
Hey, good morning, everybody. Can you hear me okay? Great. So my name is Kyle Button. I'm the Chief Operations Officer for Phoenix Counseling Center. Phoenix is one of the primary substance use providers in Partners catchment area. We primarily serve Gaston, Cleveland, and Lincoln counties. And I'll talk a little bit more about the services that we provide. And so I'll just talk about alcohol use disorder and the treatment aspects of it. And I think it'll answer some of the questions the previous gentleman just had in terms of responsible drinking. And I think the interesting thing as I talk about my agenda here is that, you know, we need to understand, is alcohol use a problem for somebody? You know, when is it time to seek treatment? What are my options for treatment? And then how do I get started? It can seem overwhelming, especially if you are dependent on alcohol or in active addiction. And we'll just talk about some of the resources that exist in this landscape, and hopefully answer any questions that you can have at the end. Next slide. I find it interesting that I didn't coordinate my presentation with Delton or with Gary and Jeff, but we touched on, or we're going to touch on a lot of the same topics here. I looked at alcohol stats from like a national level. I typically go to the National Institute of Health for stats. These stats here on this page are from 2022, which is like the most recent year-end roll-up. And as you can see, you know, alcohol use disorder is a large problem in the United States. Almost 14 million adults, you know, over the age of 18 could be classified with some level of alcohol use disorder. I'll talk a little bit more in a minute about what alcohol use disorder looks like, how it's defined, and then kind of how we, as a clinician, how we would go about treating those type of things. And like I said, it is a large problem for adults, and as similarly so, it's a large problem for our adolescent population. You know, there's approximately 40 million adolescents in the United States, and you can see the numbers of those 40 million that report, you know, having a drink, at least one drink in their life, drinking in the last year. They report drinking in the last month, binge drinking in the last month. 8.2%, almost 10% of the adolescent population reports binge drinking in the last month. And then, you know, almost 700,000 report heavy alcohol use in the last month. And those are some scary statistics. And then, you know, to couple that, 1 in 10 children live in a home with a parent that has an alcohol use disorder. So there's treatment implications both for the children and for the adult in those households. Children that live with a parent with an alcohol use disorder are much more likely to develop a substance use disorder or other mental health issues as well. And just, you know, Delton hit on this at the very beginning, but, you know, almost 200,000 people die each year in the U.S. from excessive alcohol use, compared to about 80,000 deaths from opioids. And this isn't meant to diminish the fact that opioids are a significant problem. There is a crisis, but there is a crisis with alcohol as well. And sometimes because of the social acceptance associated with alcohol use, we overlook the health ramifications, not to mention the increase in crime or violent acts in communities that result from alcohol use. You can go to the next slide. And so, you know, we just spent a minute, Jeff addressed and Delton addressed, you know, how do I know when it's time for treatment? How do I know there's a problem? How do I know that, you know, I need some help, that maybe I can't do this alone? And I think it really starts with destigmatizing what treatment is, or how do we engage ourselves in treatment. I think in the past, we have waited until there's a quote unquote real life problem. We've suffered significant consequences before we decide that treatment might be a good use of our time. And so the American Psychiatric Association has published a manual, called the DSM, Diagnostic Statistic Manual for Mental Health Disorders, alcohol use disorder being one of them. And it gives you a list of areas of your life that you can evaluate or start to evaluate to understand, is alcohol a problem in my life? Can I be can I be somebody who uses alcohol responsibly? And just like the gentleman said before me, it varies from individual to individual. So treatment has to start with an individual. They have to be willing to ask for help, or at least hear that they may need help from someone they love or a friend, or just a strong influence in their lives. So as we kind of go around the circle here, you can start to ask yourself some of these questions. Are there days and nights where I find myself drinking too much or for longer than I intended? Do I wake up feeling hungover more often than I want to? Have I asked myself, or I told myself, all right, I'm going to stop Monday morning. I'm going to stop. I'm only going to drink on the weekends. But you can't make it through the week, or you can't wait until Thursday evening for a drink or happy hour, whatever the case may be. Do I spend a significant portion of my time drinking, thinking about drinking, or recovering from drinking? Waking up in the morning, do my hangovers last longer? Do I start to experience some health issues of sorts? What are my urges like? Am I experiencing cravings? Or just like somebody said, I can't wait to have a drink. I really need a drink to deal with my kids, my work, other stresses in my life. Is alcohol use starting to interfere with your work, with your family, with your friends? Am I now late to work? Am I leaving work early? Does my family, we're not doing things that we used to do together. I don't want to be around them. I find myself more irritable with family. All those types of things. Am I starting to drink even after experiencing negative consequences? Have I been fired from a job, but I'm still continuing to drink? Have I maybe got a DUI, but I'm still continuing to drink? Even after experiencing those negative consequences, I'm still finding myself unable to stop using alcohol. Is my behavior becoming increasingly risky? Am I starting to speed excessively? Am I starting to have unprotected sex more often? Am I starting to gamble? Am I starting to move into other drugs? I think alcohol is my only issue, but now I'm starting to experiment with opioids or other things. Have I given up things that interest me, hobbies, spending time with my family, reading, whatever the case may be? Do I find myself just consumed with the use of alcohol, and then I need to spend time recovering from? Am I starting to really experience withdrawal? Do I find myself, shaky, nauseous, sweating? Do I feel an increase in anxiety or depression? All of these things can start to be telling us that there is a problem with my alcohol use. And there are different levels with alcohol use. If you experience just 2 of these, then you could be classified having an alcohol use disorder. You're on the low end of the spectrum. I think that's a really good time to answer the gentleman's question previously, is what does responsible drinking look like for me? And treatment, I think at that point is necessary. And it's not to say that drinking responsibly can't be done, can't be accomplished for some people before they truly become mentally and psychologically dependent on the drug. And then as you progress towards that moderate and severe aspects of this disorder, then you really have to start thinking maybe abstinence is the best, the most responsible, quote unquote, drinking for me. I need to be completely abstinent from it, because the risks and consequences of continued drinking just far outweigh the benefits of what I'm getting from alcohol use. And again, I think if we start to associate treatment on the earlier side before we really start to experience some of these more intense consequences, risks, then we can avoid some of the long-term impacts of this chronic disease. Next slide, please. So what are my treatment options? This can be overwhelming to a lot of people. I tried to boil it down to some basic groups here so that folks can kind of understand what is out there, what the landscape looks like. Excuse me. There are medication treatments available. You would typically find those through your primary care physician or a psychiatrist. Both folks that prescribe medicine are medical doctors. You're typically not going to get behavioral treatment that coincides with medication treatment in those settings, other than maybe some 5 to 10 minute work in a session with one of them. But typically those are going to be your medication type treatments. If you want to contact me after this, we can talk more about what specific medication treatments are available, or could refer you to a psychiatrist who could give you more information on that. But typically medication treatment should be paired with behavioral treatment as well, because this is both a psychological and physical disease once you actually do become alcohol dependent. So there are behavioral treatments available. And I just wanted to list out those people that were either licensed or certified to provide those type of treatments. You have your psychologists, which are a doctorate level provider of behavioral treatments. There's a litany, again, of treatments available that can be provided by all of these folks. And we could talk about that after. I'll leave my contact information. You're welcome to email me and hear more information about all of those. But so you have your psychologists, who are like the doctorate level providers. Then you have your master's level providers. They have received a master's level degree in some form of human development, human resources, social work, mental health counseling. So you have, in the state of North Carolina, you have clinical mental health counselors, clinical social workers, and clinical addiction specialists. Again, all of which have been licensed by the state of North Carolina to provide substance use treatment services. And there are some other options for treatment expertise that you could meet. The state will certify folks that have gone through an extensive training period, as well as apprenticeships, to become certified alcohol and drug counselors. They can provide a lot of the similar services that the licensed mental health providers can provide. And then last but not least, and some of the most important providers and work being done in this space, are peer support specialists. And your peer support specialists are people that have lived experience, in this case with substance use disorders. They are in some form of sustained long-term recovery in North Carolina, to walk alongside somebody in early recovery who is seeking treatment, and work themselves towards to show what that walk of recovery can and will look like. So those are the folks that both medication and behavioral treatments, that will be providing services to you. And then there's many different modalities or places really that you can receive treatment. You can receive inpatient treatments. Typically long-term treatments are 30-day, 90-day, 12-month programs. You can often hear them referred to as residential type programs. These vary depending on the program, whether they're 30-day kind of locked facility. There's 90-day, and you can do some locked type facility where you're confined to the premises, and then you kind of get privileges as you show gains in your recovery. And then there's lots of 12-month programs that exist, where you can slowly progress from somebody in early recovery to somebody now who's working jobs, going back to school, kind of a tiered stage programs there. And then there are short-term inpatient stays, kind of like what Phoenix offers. I'll talk about that a little bit more in a minute, but those are typically your 7 to 14-day programs, and they're more focused on stabilization, detoxification, as opposed to really more in-depth treatment programs. There are many outpatient treatment programs available. They typically come in types of group therapy or individual therapy. Groups can be anywhere from 3 to 5 to 10 to 20 people, depending on the setting. And there's different levels of intensity for those groups. They can be 5 days a week, 3 days a week, 1 day a week. It just kind of depends on where you are and how you've been assessed in terms of your use. And then again, individual therapy, where you're just working one-on-one with a therapist. And that can be, weekly, every other week, once a month. Again, just depends on where you've been assessed in your use. And then again, last but not least, and some of the most important, treatments, I lump this in with treatments because I think it's very crucial to a treatment journey, is mutual support groups that exist. I'm sure everyone's heard of Alcoholics Anonymous at some point. There's also Celebrate Recovery, Smart Recovery. And I just kind of annotated, Alcoholics Anonymous is based on a spiritual journey. Celebrate Recovery is a Christian-based journey, and then Smart Recovery is a non-spiritual journey. So there's different things for different people, as it's so individualized that there really are options for everyone. Next slide, please. So how do I get started, right? That's the big question. Where do I start my treatment journey, my recovery journey? If we go back to the circular slide there, I do identify that there's things going on in my life that I need to address. In a perfect world, treatment would kind of be really linear. We'd start with the most intense treatment and work ourselves to the least intense, but it's not linear. But I do like to use this slide to show, like I said, in a perfect world, we ourselves take personal inventory and we realize that there is a problem. I'm starting to think that I might have an alcohol use disorder, and I would like to look into some treatment. I'd like to ask for help. And I think the best place to start is to get assessed by somebody, whether that's your primary care physician or you reach out to a provider like Phoenix Counseling and say, I just don't know where to start. And providers are more than happy to give you an assessment and to say, this is based on our expert opinion is where we think you are, and this would be the best treatment program for you, treatment plan for you. But again, just kind of going back to that perfect world situation, if you were completely alcohol dependent, you can't wake up, you're experiencing those withdrawal symptoms, then you really need to be in a detox stabilization program. We refer to that as facility-based crisis. That's your 7 to 14 day short-term stay. And what you're really trying to achieve is that you're medically able, you're medically stable, you're mentally stable enough to start working on what's going on, why you're using alcohol. And then again, you kind of flow into some long-term residential, if at all possible, those 30-day, 90-day, 12-month programs, again, depending on what would be the right fit for you. And then you transition into some maybe intensive outpatient group therapy, and then step down to individual therapy. And then at the end of the day, maybe you're attending mutual support groups at the end. And that is what you need in long-term recovery. But this process can take anywhere from 6 months to 2 years, or it's so non-linear for most people that you end up starting over and jumping around and just needing to constantly go back to that initial phase and reassess what you need. Next slide. Just briefly about Phoenix Counseling. Again, we are a substance use mental health provider in the 3-county area. We provide in the 3 counties mobile crisis management services. That's non-medical, non-criminal, mental health services that folks can call. The number there is in the top right corner, and we can send a clinician to your location to provide an assessment, or we can do that via telehealth. We provide facility-based crisis services, those 7 to 14 day detoxification programs in both Gaston and Cleveland County. And in Cleveland County, we are able to accept individuals that need to be involuntarily committed. They're not able to make decisions of their own accord at the moment, and a magistrate can assign them to an inpatient stay. We also provide outpatient services in all 3 counties. And again, that can be from a 5-day program for 4 hours a day to 1 day a week for 2 hours, depending on where you are in your journey. And then in Lincoln County, we also provide a women's residential services program. That's a long-term recovery program, 6 to 12 months for 8 women. Next slide. Just to wrap up the resources I've talked about, your primary care physicians are always a good resource, a good place to start. That's where a lot of people get the majority of their health care. You can reach out to your local health department, obviously reach out to partners, and they can refer you to any one of the providers in their area. And then I just like to list the 3 sites that I use regularly to look at stats and best practices for treatment in the services. You have, SAMHSA, the National Institute on Health, and then National Alliance of Mental Illness. And next slide. Again, if you ever have a question about services and you just need somebody to get a referral or talk to, you're welcome to call our crisis services line here listed in the box. You can also email our general email at Phoenix, and somebody usually gets back to you within 24 hours. Visit us on our website or on Facebook and LinkedIn, and we can get you tied into treatment services as soon as we can. I know that's a lot to cover in terms of treatment, and I will leave it at that, but you're welcome to contact me if you need any further information.
Thank you, Kyle, for incorporating the treatment and recovery piece into our conversation. We are getting close to time. We will have our close from Paul Holden, but before we give our close, I would just like, just for any final comments or questions.
We have some information for everybody about our services if we can do it.
Yes, can you share it in the chat?
Yeah. Yes. Let's see. It's quickly. I'm Joel Benitez. I'm President and CEO of Reanimations. We are happy to provide home and vehicle modification services for all partner consumers. Okay, we can serve the 14 partner countries. Okay, and we have a professional team directed by Nasser Miranda, the executive director of Reanimation World. He is here. He can continue now. Nasser?
Hey, good morning, guys. How are you? My name is Nasser. I have a master's in psychology, and as Joe was saying, we're here to provide services for a home or vehicle that might be paid for by Medicaid. We are ready to provide services at discount for your customer, providers, and even partners, employees. That being said, even home remodeling, maintenance, and car repairs and maintenance as well. We'll drop in the chat our emails so you guys can contact us via email. Thank you.
Thank you. All right, well, we will transition into our closing.
I'm Paul Holden with Partners Health Management. I guess what I'd want to say about today was a powerful conversation about alcohol and alcohol use. We appreciate our presenters, Delton Russell of Partners, for setting up the context for the conversation today. Jeff Eads and Gary Marshall. Jeff talking about his personal experience himself, and then Gary with his work in the community over a long period of time. We appreciate that you all were willing to share that with us today. And then finally with Kyle Button with Phoenix Counseling Center. Kyle was able to share a comprehensive view and show us some resources. So we think altogether was an excellent time today. I guess what I would like to say is that also our next community cafe is May 22nd. That's a Wednesday. It's the fourth Wednesday of May 22nd, and it'll be about maternal mental health. Again, we appreciate everyone who participated today, and thanks for hanging in for an hour on Zoom. Sometimes that's gets a little tough, but again, a great conversation today. We appreciate everybody. Thanks for coming.
Thanks, everyone.